Welcome to the second video in a series called Schizophrenia Demystified. I'm Dr. Linda Snow-Griffin, a retired psychologist and mother of a son with schizophrenia. This short video addresses what causes schizophrenia. First, let me tell you what does not cause schizophrenia. Despite some people's fears about being around someone with schizophrenia, it is not contagious. Spending time with someone with schizophrenia will not result in getting this illness. Second, it's not related to being so super smart or creative that your mind just can't handle reality. Yes, there are some very intelligent people who have schizophrenia, but there are also many people with average and below average IQs as well. Because of the way IQ is assessed, it's hard to accurately test intelligence when someone has schizophrenia. Most likely, it affects all ranges of intelligence. Also, parents do not necessarily cause this illness either. Bad parenting can lead to other problems, but not necessarily schizophrenia. While no parents are perfect, there are many good parents who have loved and cared about a child who eventually develops schizophrenia. So now that I've told you what is not directly associated with this illness, what actually does cause schizophrenia? Certain genetic factors may contribute to problems that develop in the frontal lobe of the brain. Genetic studies indicate a higher incidences of schizophrenia among close family members. Early studies back in the 1970s of identical twins who were adopted by different families found that schizophrenia is associated with biology and not the home environment or the caregiver's behavior. An identical twin who has a twin with schizophrenia is 50% more likely to develop schizophrenia than the general population. If both parents have schizophrenia, the odds of developing the illness are higher than if one has the symptoms. And the odds decrease based on the closeness of the relative with schizophrenia. This does not mean, though, that because you have a family history that you'll definitely develop the illness. It just means that the odds are somewhat greater than the general population. When studies first identified genes as a major culprit, scientists were unable to identify which ones were responsible. More recently, they have found that the C4 genes are higher in people with schizophrenia. These genes influence what's called genetic pruning during adolescence and early adulthood, which is the time when the condition usually develops. Genetic pruning is a natural process that occurs when unneeded synapses are eliminated to help your brain function more efficiently. Excessive pruning, when too many synapses are eliminated, appears to lead to symptoms of schizophrenia. Because genes are so interdependent, more than one gene is probably not just the C4 is likely to be involved. Separating the influence of each gene can be very complex. At this point, gene studies in general point to a complicated but a hopeful direction for understanding what causes schizophrenia. For those with a genetic predisposition, excessive stress has been associated with the development of the illness as well. This could be any type of trauma or excessive stress. Since the symptoms of this illness become noticeable usually in late adolescence or early adulthood, it could be the developmental stressors related to becoming independent could be a possible trigger for some. It is not uncommon for predisposed students who go away to college for the first time to be diagnosed with schizophrenia at the college counseling center. There is also the possibility that brain structure and neurotransmitters such as dopamine in the brain may develop differently and can contribute to schizophrenic symptoms later in adolescence. These differences may even begin to occur before birth. Again, more scientific understanding is needed. Also, pregnancy difficulties, including viral infections, malnutrition, and birth complications, may be associated with schizophrenia in a small percentage of cases. What is known for sure is that schizophrenia is a brain disease that is complex and not completely understood yet. A common phrase that I've heard to understand the effects of genetic and environmental factors is the roll of the dice. And that may say it all. It isn't anyone's fault, it's just the way the genes unfolded. So the next question is, can this serious mental illness be cured? And that is the topic for the next video. So please join me for the next part of Schizophrenia Demystified. Also, you can check out my website, lindasnowgriffinphd.com. And if you have any questions, my contact information is on the website. Thank you for watching this video, and I hope you join me next time.